I am Dr. Chandrika working as an obstetrician and gynecologist in Chirag Hospital, Bangalore, JP Nagar, second phase. I also do a visiting consultation at Malti Manipal Hospital, 9th block, Gynagar, Apollo Cradle Hospital, 5th block, Gynagar, and as also Motherhood Hospital, Banshankari, second stage. Importance of transvaginal scan. As you all know, scanning is nothing but ultrasound scan, and in the ultrasound scan we have two types. One is transabdominal scan and other is transvaginal scan. This comes more in ladies because our organs, our gynecological organs are in the pelvis, and the visualization depends on the probe of the ultrasound machine. So routinely what we do, that is abdominal scan, we put the probe and the abdomen. Whereas in transvaginal scan, it is that probe is put into the vagina. See, this is the uterus, these are the tubes, and this is the vagina. Suppose I am doing transvaginal scan, this is the probe, I put the vaginal probe here, just we put it inside here, and you can see here that this is the mouth of the uterus. And we have organs like ovaries, the tubes, and we have also the uterus, which is having the pregnancy or whatever it is. So what is the meaning of transvaginal scan? It is we put the probe here so that the probe surface becomes closer to the organs of the pelvis. So that is the advantage of the transvaginal scan. This is done more in cases of early pregnancy scans and more often in the adnexal region, that is the structures that are near the uterus, that is for example the ovaries. See, when you are trying to conceive, that time we try to do what is called as ovulation scan. Ovulation scan matlab what is the thing happening in the ovaries. So we want to see whether the egg is growing, how healthy is the ovaries, and what are the problems that she is having by the side of the uterus. To visualize those things, the better option would be transvaginal scan, because the scanning, that probe is much nearer the organ that is being scanned. So that is called as transvaginal scan, and that is the advantage of the scanning that we do nowadays, because in those days we did not have this transvaginal probe, and that time we always had to depend on the abdominal scan only. And so many people are very obese, and if the obesity is so much, because the abdominal wall will be thick fat, it will be full of fat. So by the time the ultrasound reaches the organs, it will be very far. The distance between the probe and the pelvic organs will be more. So the clarity will be less. So when we want to know the proper clarity, it is better to use transvaginal scan. But when there are some masses or some tumors which are very huge, and those tumors we cannot assess only with the transvaginal scan, because it will give us a limited access. So in those cases we have to depend on both transabdominal as well as transvaginal scan. That is the thing I wanted to explain about transvaginal scanning and its advantages.